Hi, and thank you for joining me on another episode of Ask Dr. Corine. So today we will be talking anxiety. So those of you who may not know me, my name is Dr. Corine Ferebee, and I am the CEO and founder of Trinity Wellness RX Consulting, where we help women prioritize their health with medication therapy management, nutrition recommendation, and exercise programming. So I am super excited. We have a great guest today, Miss Trudie German, right? German. She's a certified personal trainer and wellness coach, and she is here with us to discuss anxiety. Thank you so much, Trudie, for joining us.
You are welcome, Dr. Corine. Thank you so much for having me and my coffee.
Of course, of course. So, Trudie, tell us a little bit about yourself.
So I am a certified personal trainer and I work with women 30 and over. And I'm always asked, do you work with women over 40? Yes. I help them to look and feel well. And I also offer workshops to corporations and organizations on how their employees can manage stress, how they can be healthier at work, increase productivity. And of course, with COVID, I've been doing that virtually.
Right, right. So you work with individuals and with the corporate arena as well.
Correct.
Okay, awesome. So let's talk anxiety. And
Mm.
for a lot of people, they think they experience anxiety. It's like, I think I may be experiencing anxiety. I'm not sure. So can you tell us a little bit about what anxiety is and what it looks like?
Anxiety is basically you have the fear of something. You know you fear something. It's as if sometimes I realize different people experience different symptoms. So some people, it could be constantly thinking about things. And it's usually things we have no control over, right? And we're
Mhm.
just constantly thinking about it and always playing out worst case scenario. It's not just thinking about it, but we have to go to the extreme of the worst case scenario. And then we can't function. We start stressing. We can't sleep at night. We toss and turn. The next day we're moody, we're cranky. Basically, we're constantly thinking about something and fearing it.
Right, right. I know for me, my first experience with anxiety was at work. I got
Mhm.
into a job that was so stressful, and before I knew it, I was so irritable. I was exhausted. Like you say, I just couldn't stop thinking about it, and I would always think about what the worst scenario would be,
Mhm.
and unfortunately, I didn't really realize that's what I was experiencing until it got to the point that it got so uncontrollable. Before you knew it, I was having panic attacks. So we want to help people not have to experience panic attacks.
And I think that's one of the things most of us, because I know the first time I started experiencing anxiety, I had no idea what it was because, of course, we're from communities where we don't talk about those things. So
Exactly.
I had no idea what it was until mine even got to the point where it was, depression. Because I basically tried to suppress it, but you can't suppress something for so long, content under pressure. And then you're also embarrassed to ask for help because you don't know how to explain exactly what it is you're feeling and not feeling. And also that shame, you have so much pride, you're afraid of being judged.
Yeah, I think that's a great point that you brought up, the fact that we don't talk about it in our communities,
Mm-mm, we don't talk
and
about
if you
anything.
do, people are kind of looking at you with the side eye, like, you need to warm it up and just handle whatever it is the world is offering to you.
Or
But
you need
really,
to pray on it. Come on, let's not
go to
let's not
church.
forget, go
Go to
say
church.
your prayer
Yes,
and go to church and read your Bible. Not
yes.
that there's anything wrong with that. It does work, but sometimes we need more than
You
that.
need more. You need professional help. So,
Exactly.
speaking of that, what should we do if we start to experience signs of anxiety?
So if you notice that you're experiencing signs of anxiety, first thing, you need to understand what it is you're feeling. So you're constantly thinking about it and you're thinking about something you can't control. It's not that you're thinking about the laundry. You can get up and do the laundry, right? But you're thinking about things you can't control, especially during this pandemic. A lot of us are thinking about How much longer am I going to be at home if you're at home? And for some people, home may not be a happy place. What happened if I lose my job? What happened if I can't pay my bills? And we start thinking about all those things that we cannot control. So I would say, first, identify what's the root cause of your anxiety. Not just, oh, I'm feeling anxious because of work. Okay, exactly. What about work makes you feel anxious? Is it you're being inundated with work? If you're being inundated, can you ask for help? Can you structure your day better? Can you ask for, hey, I need help with this? Can you ask, are you also struggling with work and family? Can you ask for help? Again, if you have children that are old enough to help out, create a schedule where everyone has roles or duties. If you have a partner at home, you kind of coordinate that. But I find identifying the root cause first is the most important thing. You can't treat what you don't know. It's
Right.
that simple, right?
I agree. Think it's very important to know what it is that's causing the anxiety, because I do hear people say, I'm anxious all the time, or I have anxiety, and I'm like, well, what's the problem? And I don't know,
and that's another thing. I think it's also one of those words that gets thrown around sometimes, because I've heard that before, and it's like, okay, what makes you anxious? Oh, I just feel anxious. Okay, but what's the cause
right.
of it?
Have to dig a little deeper.
Exactly.
So who should someone go if they think that they're experiencing anxiety? How should they navigate the system to find out if really that's what it is, and then what should they do about it?
I definitely say, if you feel as if you're experiencing anxiety, definitely schedule a phone call or an appointment with your doctor. If you can't get out to see your doctor now because of the pandemic, a lot of areas have places where you can call in to discuss how you're feeling, what you're feeling. And what I would also say before I go that far is, once you've identified what's going on, is it when you have conversations with certain friends and or family members? Because sometimes we're okay until we get on the phone or receive a text message from certain friends or family, and it's just like everything starts coming up. And if it's that friend or family, what conversation, like right now, I know for me, I don't want to have any conversations with my friends or family about COVID-19. It's there. I feel as if I'm being inundated about it. I personally cannot do anything about what's going on out there. I know what I can control with myself and in my household. So the minute anyone gets going in that conversation, we're not doing that. I remind them, and if they keep going, I'm off the phone. It's that simple. So you need to understand, is it certain family members, certain coworkers, certain friends that when you get on the phone with them, or even just seeing their name pop up on your phone, it sends you there. And I know some of us, we're bound to family and friends where it's like, oh, but it's my sister, but it's my mom. That's all fine and dandy, but it's your health. You got to take care of you. And if interacting with certain people is triggering that anxiety, you have to figure out what's more important: managing your mental, which also is your physical health, or this relationship. And also set boundaries, right?
Yeah. Yes, boundaries.
We need boundaries. Like, we can talk if that person, having a regular conversation with them is okay, but the minute it starts going to something like COVID, let them know that. And if you realize that they don't respect that boundary, end the conversation before it gets there. And don't be afraid. You're taking care of yourself, right?
Right.
So that is one way. And we all have our smartphones. We are always on our smartphones. I always say this: what's popping up in your feed? Whether it's in your Instagram feed, LinkedIn feed, what's on your Facebook feed. When you see those things popping up, how are they making you feel? Are they draining your energy, or are they lifting you up? If they're draining you, Why are you following them? You can't control what they post, but you can control what shows up in your feed. So guess what? Clean house, delete them, right? Another thing is the news.
Yes.
Yeah, we need to be informed, but do you need to be informed 24/7? Do you
Absolutely.
need to be informed as soon as it's breaking news? Can you be informed twice a day, in the morning and in the night?
Mhm.
Right? So those are things that I think we do subconsciously, especially with the phone. We get up, we awake in the mornings, we reach over, we start looking, and before we even get out of bed, the anxiety kicked in because of the news, right? And what's popping up in our feed. So those are some of the things, and that goes back to identifying exactly what it is that's triggering your anxiety.
Yeah, I think those are such good points because even past the COVID-19 situation, the having a phone in your hand from the time you wake up to the time you go to bed is just so detrimental to your health, to
It
your
is.
well-being. You
And
know,
I
at some point we have to put it down and just take some time for ourselves, and that goes back to prioritizing yourself,
Mhm.
setting boundaries with yourself, and saying,
Exactly.
I have to put this phone down. So yeah, great, great points. So now that we know kind of like what anxiety is, what it looks like, how do we know we should contact our doctor, of course, but what things can we do to help us manage day-to-day anxiety once you've been diagnosed?
um Certain things that we should definitely refrain from: drugs and alcohol, because
Mhm.
those are, you know, right now in Toronto, beer and liquor stores are considered essential services.
Here as well, yes, that was ridiculous.
And oh, and of course in Canada, marijuana is legal. So the marijuana store, so we got beer, we got alcohol, we got weed, they're legal. Now, while marijuana can help with, you know, anxiety, once again, I am not a doctor. I'm not telling you to go out and get weed because of that, because some people do have prescription for that. So if you have been using that for prescription, go ahead and listen to your doctor. But drinking alcohol, wine, beer, any type of alcohol, that's something that you should definitely keep away from if you're experiencing anxiety. And I
Mhm.
know some people may be like, oh, but it makes me feel better. It calms you. It calms you for the moment, but then tomorrow when you wake up, now you still have another issue. Then you're going to want more. Now you're making things worse because now you may end up becoming an alcoholic.
Mhm.
Another thing is food, the foods we eat, sugar. Sugar, as you and I know, sugar is an addictive drug, and especially being home, a lot of us are snacking. We're having chips, we're having pop, or sodas, you guys call it, we call it
Yeah.
pop. You're having cookies. All that refined sugar definitely does mess with our brain. And of course, that affects our anxiety.
Mhm.
So, grab some fruits, grab some vegetables, some healthy stuff. And going back to what you're saying about, taking care of you, what do you like to do that makes you feel better?
Mhm.
Because in in these times, we're not thinking about what do I like to do. Of course, with anxiety, we're constantly thinking about stuff that we cannot control, and that's what we keep focusing on. Okay, how about you understand, or go and do something that you like doing, right? That definitely makes a huge difference, because that is also taking your mind off of it, that's making you feel good. And that's also self-care, which should be every day, not just on Sundays.
Right. I agree. I have a friend, whenever she gets anxious or, starts to feel down and depressed, she dances. She loves to dance.
Yes.
So dancing is like the best, because who can dance and still be sad, so.
Exactly. And those are the things we don't realize. Like some of the tips I want to share is movement. Just think about, as you said, who can dance and be sad? Dance is a movement. And you don't have to be a Beyonce or a J-Lo. Just dance, move, dance in the mirror while you're brushing your teeth. Just move. Another one is laughter.
Yes.
Like, you cannot laugh and feel like crap. I always say, if you're feeling crappy, just laugh it out. Just, if you don't have anything right then and there to think about, just remember something funny, find something funny on Netflix, find something funny and watch it and laugh, and you'll just feel so much better. And of course, working out, because that is a type of movement, right? When you're working out, you're releasing, dopamine, you're releasing the happy hormone, the natural hormone, endorphin, all those things. So definitely move. You're sitting down and you feel the anxiety coming on, jump up, perform 10 jumping workshops. We're trying to stay connected, check on friends, check on family. If we have children, help them with their schoolwork because they're home. So it's just like breathe. That's something. And, we mentioned food and movement, and definitely pouring into you and be kind to yourself. We do not do that enough. And especially women, we're not kind enough to ourselves. We beat ourselves up for what we didn't accomplish that day, as opposed to what we were able to actually accomplish, right?
Absolutely. Learning to celebrate the wins. That's one of the things that I'm doing, because like you said, we focus on what we didn't get accomplished.
Exactly.
What we did. And sometimes we just have to give ourselves permission to prioritize ourselves. And like you say, be kind to ourselves. I love that.
Exactly.
Yeah. So anything else, any other nuggets you would like to give to our listeners when it comes to anxiety?
What makes you happy? Do more of it.
Yeah.
Whatever it is it reading a book? Is it binge watching a series on Netflix? Is it watching the same show 20 times?
Yeah.
Is it cooking? Is it cleaning? Mind you, none of those bring me joy, but
yeah, I think I'm with you on that.
Do more of what makes you happy. And all these things sound like a cliche, but they do work, right? If you put them into action, they do work. If you do move, it does make you feel better. If you do laugh, it does make you feel better. If you're already feeling crap and you just lay on the couch and just think about it, nothing's going to happen. You're just going to feel worse and worse. So ask yourself, what makes me feel better? And also, if you notice that your anxiety is about to kick in, acknowledge it. Acknowledge it, because sometimes we're afraid to acknowledge it, and then move on. Don't acknowledge it and stay there. As someone said to me years ago, when, I didn't learn all these things, I wasn't practicing them. They're like, okay, you can either stay in the manure. They didn't use manure, but you get the gist.
Yeah.
Like you can either get out of it, or you can stay in it and roll around. Just the visual of laying in the crap and rolling out, I slowly picked myself up. Yeah. So acknowledge the crap, but just don't stay there. And when you feel that you're going there, don't feel bad about it. It's just a matter of how long you're staying there. That's where the issue comes in, right?
Right.
So yeah.
I think that is great advice. I really, really appreciate you coming on and talking to our listeners about anxiety. If anyone wants to find you and get in touch with you, how would they do that? I am easy to find like Sunday morning. Power's back on. If you are, I'm on the web, bodyenvy, bodyenvy.ca. On Instagram, bodyenvy1, Facebook and LinkedIn, Trudie German, TrudieGerman. Perfect, perfect. And I'll also link your information down in the comments. So
Yes,
again, thank
thank you.
you so much for joining us. We made it through all of the technical difficulties. And we
Yay!
will talk again soon. So guys, thank you for listening, and I will see you soon. Have an amazing day.
Bye.